Hi, I'm Mr. Suresh Chandrashekar. I'm an orthopaedic consultant specializing in foot and ankle surgery, and I have consulting and admitting rights here at London Independent Hospital, which is part of the BMI group. My specialism is to deal with most injuries and degenerative aspects of foot and ankle problems in both young and the old. My current specialisms and interests are those of restorative methods of managing injuries to the joints, as well as problems that arise from sporting injuries in young and the old. I see a good amount of people coming through the doors here at London BMI Independent Hospital with injuries to their ankle, which involve both the joint as well as injuries to the Achilles tendon and other ligaments of the ankle and the foot joints. I definitely believe that there is a strong focus on rehabilitation and management of such patients here at the BMI group of hospitals. Any regular patient who comes in with an Achilles tendon injury with a suspicion of it gets assessed thoroughly by myself and my group of physiotherapy and rehabilitation practitioners. We believe in getting a strong multidisciplinary approach in managing such injuries. What one could expect is to get a clinical assessment in a thoroughly holistic manner and approach towards managing this in a well-defined and a shared decision-making principles. I usually organize a dynamic ultrasound scan for such patients after going through a clinical assessment and then discuss treatment options depending on the findings of their scans. Most of these patients can be managed without surgery, and we have good rehabilitation protocols that we can institute in conjoint action with our physiotherapy colleagues here in the hospital. Those that require surgery are given a good feedback in terms of what they would require before and after their surgery and are well looked after. The other injuries that I can see in this place are those of ligament damage following sporting injuries, which either can be acute or having had a few times before. I believe that a large number of us have ankle sprains and go over our ankles which do not get treated adequately to begin with. Hence, you have niggling and recurrent injuries which this add up. So my other popular surgeries or management include collateral ligament injuries to the ankle, which can be treated with keyhole surgeries as well as ligament repair surgeries, and I have some excellent feedback from my patients who've had treatment under my care. Overall, I believe in strong patient focus and a very centered approach with a group of multidisciplinary professionals in my practice, and I believe in strongly associating patient-related outcome measures to help me judge the success that these patients have gone through under my care. We've got the weekend football players who are really itching to get back on the pitch after this lockdown, and they find that explosive kind of kick at the back of their legs when nobody's around them. And this is a very classic presentation with inabilities to then run or carry on playing their game. So they hobble out of the pitch and they ice it, they tend to kind of nurse it back, but clearly they are unable to walk on it properly. Most of them possibly go to the A&E and they get assessed over there, and a preliminary diagnosis is established. What I would strongly recommend to these people who have an Achilles tendon injury is to not put it off, i.e. seek advice as soon as they can and get the appropriate diagnosis and the investigations that's going to get them back on their feet in terms of recovery. I would say anybody who wants to return to their previous level of activity status, that is the pre-injury status, it could take a good bit of 10 to 12 months at the very least. Even then, at that point in time, they may not be 100%. So it's an ongoing process. In my practice, I've treated masters professionals, semi-professional athletes, and recreational sports and runners. And clearly, the feedback I get is it takes at least 12 to 14 months to go back to the activity that they used to do before. Surgical intervention has come a long way. There are keyhole options nowadays which require minimally invasive approach to these fixations, which requires less soft tissue injury, and thereby the recovery is better. They have or will be put through an accelerated rehabilitation protocol, which I've devised with my physiotherapy colleagues, and it gets them independently walking within 8 to 10 weeks after the surgery.